All right, so I'm going to work with what I call a smash and mobilization. So I'm using a lacrosse ball here. A lacrosse ball is pretty aggressive. You can use a tennis ball if you want a little bit less pressure through the muscle itself. But what I'm going to do is say I'm working on piriformis or somewhere in the glutes that's tight, especially if you're having low back pain, then this is a good exercise to do. What you're going to do is you're going to kind of take the lacrosse ball, you're going to put it up in the high glute, and you're going to use your arms and your legs to kind of rotate around on that lacrosse ball. Okay, once you find a sensitive spot, you can do two things. You can move the leg, so if it's on the right side, you move the right leg, and you can kind of move the muscle over the pressure that you're putting through that leg. You can even do extend out, extend in, and just really get into that muscle, okay? Or you can do little tiny pulses in different directions around that sensitive spot. What you don't want to do is have so much pressure there that you're crying at the end of this. You're feeling so much pain. So you want to keep the pressure to a manageable level, and you're just really getting into that muscle, kneading it out. And then what I'd recommend doing after that is stretching that muscle, and then maybe even activating that muscle. So if it's the glutes, you can do banded glute work, or even like little pulses, working the glute max and glute medius, and just making sure that you're making the muscle, setting it up for success. Sometimes when we get a lot of mobility that we didn't normally have, we can set ourselves up for injury. So just know that you got the smash and mobilization, then you would do a nice stretch, and then if you're feeling up to it or you're about to go do some exercises, then I would activate the muscle as well. So there you go.